Okay, gentlemen, the third part of today's discussion is vascular tumors. Uh, this is a table showing the important vascular tumors with respect to your curriculum. There are four tumors which I've highlighted. These are the ones that are most important with respect to your examination point of view. So I'll concentrate more on these tumors. Hemangioma with its different types, lymphangiomas, then Kaposi sarcoma and angiosarcoma. You can read this table out, and a question may be asked that enlist different benign and malignant neoplasms of vessels. So this is how you can write one or two from each category. Now hemangiomas, most of them are seen in the infancy and childhood, and a lot of them eventually regress spontaneously, and a lot of them are confined to head and neck region. Some may be found in the liver, but this, remember, this is a tumor that is many times asked in the exams, even in pediatrics hospitals. So you should remember this tumor, hemangioma, that it's common in infancy and childhood. This is how it may look like. This is an example of hemangioma, one on the tongue and the other on the internal portion of the lower lip. Um, I don't have a picture of the one present on skin, but they are present on skin as well. Now, this is you can see a localized reddish color lesion, and which upon sampling may look like any of these two. Now, this is the most common one, which is termed as the lobular capillary hemangioma, and this is the other type that is known as cavernous hemangioma. Now, lobular capillary hemangioma, this one is a lobular, as the name indicates. It is also known as the pyogenic granuloma, but it's not a granuloma exactly. It's a lobular proliferation of vessels lined by plump endothelial cells. So this is how a lobular capillary hemangioma or a pyogenic granuloma looks like. This is a lobular proliferation of vessels which are lined by cells, lined by plump um, or enlarged endothelial cells, which do not show any that kind of nuclear atypia that warrants a diagnosis of a malignancy. Okay, so this is a tumor. This is a benign tumor. Okay, now then cavernous hemangioma. This comprises of variable dilated vessels, which may be thick walled in different regions. These are lined by endothelial, small endothelial cells. You can see, if you see, this is a dilated vessel, and these are lined here by um, and flat endothelial cells. Okay, and in between this pinkish thing, these are the RBCs. So this is an example of a cavernous hemangioma. Now, lymphangiomas are benign lymphatic counterparts of hemangiomas. They almost look like hemangiomas as far as you're concerned. Uh, there are a few differences, but remember that these are benign lymphatic counterparts of hemangiomas. And this is how a lymphangioma may look like. I have taken this picture from a research article. So this is lymphangioma of a palatine tonsil. There are similar. There are dilated vessels, um, um, variable size, lined by flat layer of endothelial cells, and lymphoid follicle may be visible in the periphery. This is immunohistochemistry that has been performed. Sometimes when there's confusion that whether it's lymphangioma or hemangioma, then appropriate immunohistochemistry can be performed. But again, these are also dilated uh, variable sized vessels, and in between some lymphatic material may be seen sometimes. Okay. Another tumor known as the Glomus tumors. These are also benign tumors. These comprise of these vessel-like areas. You can see here, these are also lined by endothelial cells. These empty areas are those areas I'm talking about. And in between There is a proliferation of small ovoid cells with round oval nuclei with eosinophilic cytoplasm, which is highlighted in this picture. So this is glomus tumor. Glomus tumors generally present and at the fingertips with pain, which is the classical history, and this is how they look like histologically. There are vessel-like areas lined by endothelial cells, and in between there's proliferation of cells with eosinophilic cytoplasm and round oval nuclei, and there are no mitosis generally. Bacillary angiomatosis is a tumor-like lesion, um, which also shows um, lobular proliferation of plump endothelial cells, but there are interspersed neutrophils, and when special staining is performed, you can see these tiny blackish organisms. Bartonella species is responsible for producing these kind of lesions. Kaposi sarcoma, very important with respect to Eurospes. There are different types of Kaposi sarcoma: classical, African, age-associated, iatrogenic. You're most likely to get a scenario saying that patient who is HIV positive presents with um, these kind of lesions on the skin. They may be purplish, irregular, um, non-circumscribed kind of lesions. You can see here, you can see here, and uh, this is the histological picture. So your most likely diagnosis is going to be Kaposi sarcoma. If somebody mentions that the patient is positive for HIV, and then there is a spindle cell proliferation, this is the spindle cell proliferation. There are two different pictures, but both show the spindle cell proliferation of cells, and the examiner tells you that, or the scenario tells you that there's a spindle cell proliferation and there are slit-like areas in between. You can see some of these slit-like areas like this one here, this one here. So this is most likely Kaposi sarcoma. Okay, I repeat, HIV positive patient, spindle cell proliferation, slit-like vessels, and with some erythrocytes on those slit-like areas. It is most likely going to be a Kaposi sarcoma they're asking about. Then there are different types: age-associated, yes; African, classical, iatrogenic, but HIV-associated is the most important one to remember for you. Okay. Um, Now moving on to angiosarcoma briefly. Angiosarcoma can be found at various sites. Okay. Um, the angiosarcomas can be radiation associated as well. If a tumor is treated, for example, a breast tumor is treated and a radiation therapy was given, an angiosarcoma may arise even at that site. What's the histological picture? These are different interconnected vascular channels, as you can see here. Different interconnected vascular channels which are lined by endothelial cells which show marked atypia. Okay, this is not like a lobular capillary hemangioma or a cavernous hemangioma or a lymphangioma. The cells lining these interconnected vascular channels show a high degree of atypia. You can see many of the cells are enlarged. Some of the nuclei show prominent nuclei, and here there are a lot of nuclei that are showing prominent nuclei. The large epithelioid kind of cells, nuclei are prominent. They're marked atypical. There's marked atypia. So this is how an angiosarcoma looks like. Okay, so interconnected vascular channels lined by cells that show marked degree of atypia, nuclear polymorphism, prominent nuclei. This is how an angiosarcoma looks. This is how a scenario of angiosarcoma may be given. Okay, so this is it for now. These are the selected um, tumors and that tumor-like lesion of the um, vascular system. These are the references for today's discussion. Uh, Please let me know if you have any question. Thanks a lot.